Hi, this is Dr. Christopher Wood here at Arizona Sports Chiropractic, and today we're going to show you one of our favorite stretches, mobilizations for our golfing athletes. But before we do that, I want to kind of give you some practical application to this stretch. This is LPGA professional and our current patient, Lindsey Weaver. Lindsey was an All-American at the University of Arizona and started on the LPGA Tour in 2018. She had a promising start, but part of the way through the season, she started to develop lateral wrist pain and swelling. She got treated by the medical professionals with the tour, and unfortunately it didn't help at all. And it got so bad, she had to withdraw from the tour altogether. She went back home, saw some other medical professionals, and unfortunately they couldn't help her either. When she came to our clinic, the first thing we did, and what we do on all of our new patients, is called a functional movement assessment. Now, this will enable us to be able to look at the quality of her movements, especially as it applies to golf. And what we found on Lindsey was that she had a significant lack of thoracic or mid-back rotation. Now, we know golf is a rotary sport, and that rotation comes from three primary areas: the thoracic spine, the hips, and the ankles. And with her lack of thoracic rotation, it was creating a compensation and putting too much stress on the ligaments and the muscles and tendons in her wrist. So after showing her this stretch, she was subsequently able to start swinging again, and we addressed that situation to the point where she got back on the tour, and in 2019 she was able to compete in every tournament and didn't have to withdraw because of injury for any of these. So the moral of the story is, most of the time when you're feeling pain, it's usually not coming from the area you're feeling the pain. It's coming from a compensation someplace else. So it's important to try to look at the body altogether, and especially the movement patterns involved in that particular sport. So with this stretch, we call this a side-lying thoracic rotation, and that is one that she did initially and she still does every day to this point. So now we're going to go into this stretch and show you how to do it yourself. This is April. She's going to help us demonstrate this exercise today. So what you're going to want to do is lay on your side, and you want to try to pick a firmer surface. You know, if you have the ability to get on the ground, I would definitely get on the ground. I don't usually recommend doing this on a bed or a really soft surface. So you can see April's laying here on her side. We're going to give her a pillow just to support the neck. You don't have to do that, but for comfort-wise, you can. So we want to make sure that she's pivoted right on the shoulder. A lot of times people will roll. You don't want to do that. So you want to make sure you're right on top of the shoulder. This arm's going to be here. Your hand's going to be pointed out. Now with the legs, you're going to straighten the bottom leg, bend the top leg, and you're going to tuck that knee right into where that Achilles is on the lower part of the leg. And what we want to do is be able to keep this knee pushed into the table and keep this elbow pushed into the table, and make sure we're in a good position. So like any movement, you want to establish stability before you try the mobility. So we want to activate her upper and lower core. So what she's going to do is push her elbow and forearm down into the ground, and she'll kind of lift a little. She's not going to lift off the ground, but she can feel some of the pressure being taken off here. That's going to activate the upper core. Now also, she's going to exhale or inhale and push into her core here. Keep that core tight. Now we're going to go through this in a subsequent video, keeping the intra-abdominal pressure high. And she's going to keep that knee pushed into the table. Now from there, now she's ready to isolate that thoracic mobility. So she's going to bring her arm here, and just like she's pulling back a bow, she's going to try to rotate that thoracic spine as far as she can. So she's getting extension and rotation in that thoracic spine. Now the whole time she's keeping her stability points here at the knee and pushing into the table there. So she's using those stability points to propel this motion and get some nice thoracic extension and rotation. Now usually I would recommend doing about 10 repetitions per side, but if you find while doing these that one side is tighter than the other, then I would try to add a couple more on the side that's tight. We always want to have our movements be symmetrical, okay? So again, this is a great one to start to do immediately. It can help just about every golfer. I would do it before you go out and play. Definitely do it at other times as well. But again, this is our side-lying thoracic rotation to help get some nice rotation in this area. Now, if you're watching this video and you have any questions, or you're in pain and you're wondering where it might be coming from, or even if you're not in pain, but you want us to test your movement quality as it applies to golf, feel free to call our office. If you mention that you saw this video, we will do a full functional movement consultation exam free of charge for you. Thanks for watching. Have a great day.